Good morning, good afternoon, good evening, wherever you are, to everyone on the line. We are excited to have a great panel of womanist and feminist leaders from the sub-Saharan African region share their experiences and their insights and perspectives on how we enhance the voices of girls and young women in the national and global response to HIV in this subpopulation. The webinar session today will provide examples of effective strategies for engaging girls and young women in all their diversities to address HIV prevention, their sexual and reproductive health, and gender-based violence. We will also delve into ways in which to account for the girls and young women's voices in the development of national policy and in national program design. And if we do our jobs right, we'll secure some advice from not only the panelists, but many of you online on how to engage those who are interested in becoming more active leaders on the issues of HIV prevention, SRH, and gender-based violence. In the meantime, I have the pleasure of introducing to speak to us and give a few opening remarks, Dr. Chewe. Dr. Chewe is the section chief and associate programs director here at UNICEF New York and serves in various advisory and senior leadership roles, very particularly within the community of children affected by AIDS, and also a strong advocate for strengthening the response to girls and young women globally. Chewe, over to you.
Thanks, Lola, and thanks, Pam, and thanks everyone that's listening to this. But my task is very small in that we have Dalila, who will be giving us, from the Global Fund, who will be giving us a broader overview of what this is about. But I wanted to just say this has been a collaborative effort between UNICEF and the Global Fund. Our response to the adolescent girls and young women agenda and the catalytic initiative that Global Fund is actually supporting in a number of countries is to make sure that we are at the cutting edge of what is it we need to do. So UNICEF does collate the data in terms of the progress we're making, and we know where we are. But more importantly, we want to make sure that we are able to share the emerging evidence as we see it, and also to make sure from the bottom up, we're able to talk to some of the learnings that are coming out of programs themselves and some of the concerns that are coming out of the providers and implementing partners on the ground. The adolescent girls and young women agenda is complex because it touches on many vulnerabilities that girls and young women are going through. It requires a multi-sectoral response for us to have impact and for us to have the comprehensiveness that we need. That comes with challenges in terms of the quality of programming that we are providing and who is even checking in on that. So we're hoping with this collaboration with the Global Fund, we can give you timely learnings and evidence that can help shape and inform how you program for adolescent girls and young women on the ground. Thank you.
Thanks very much, Chewe. Next, we have Dalila Zachary from the Global Fund. Dalila is a medical doctor specializing in infectious disease. She's a consultant with over 15 years experience as a clinician, a teacher, a researcher, an advisor in HIV and infectious diseases, and has served in this capacity, providing strategic input to the Global Fund's programs in over 15 countries, including high-impact Africa and Asia, such as Kenya, Uganda, India, and more. She also works closely with the health system strengthening, community system strengthening, human rights, and gender advisors across the breadth of the Global Fund's structure to ensure strategic investments within HIV. Dalila, it's a pleasure to have you give us a few remarks on this learning collaborative. We welcome you. Over to you.
Thank you so much. I want to first just thank the vision and the commitment of UNICEF, and I thank all of the collaborators who are online, our guest speakers. This is a wonderful opportunity, and we're thrilled from the Global Fund. What I'd like to do is just take a few minutes to just give a bit of background and overall vision for this learning collaborative, and talk about some of the principles that have underpinned this initiative and why it's so important for the Global Fund. So the Global Fund has committed, as you have, to the aspirations and goals of the overall global prevention strategies and coalitions. And we are actively engaged in all of the efforts to improve our prevention efforts, investments around the 5 pillars, but especially this one around AGYW, which the Global Fund has endorsed 100%. So what I want to do is just start a little bit with the data again, which we all know, because data and how we interpret, utilize data is really the foundation for everything we do. It's a great motivator, and it helps us to advocate for the resources we need. So in 2018, every week, around 6,200 to 6,900 young women aged 15 to 24 became infected with HIV. So that's over 300,000 a year. That's almost 20% of new infections in 2018. And in sub-Saharan Africa, 4 in 5 new infections among adolescents aged 15 to 19 years are in girls, and young women aged 15 to 24 are twice as likely to be living with HIV than men. So one of the global prevention targets that we have all signed up for was reducing the number of new infections among adolescent girls and young women to less than 100,000 by 2020. And currently we are off. Why are we off? And why this platform is so important, I just want to spend just 2 more minutes talking about. So why are we off? Of course, there's the money issue. So this current funding cycle, the Global Fund increased their country funding allocations going towards AGYW, as well as committed $55 million in catalytic funding for 13 of the most affected countries in Southern and Eastern Africa to support integrated prevention, treatment, and care programs for AGYW, including programs such as keeping girls in schools, services to address and prevent gender-based violence, social protection programs, girls empowerment groups, youth-friendly services, and care. But with all of these additional funds, which likely exceed $150 million, we still have not reached 100% coverage in every single district that is high burden and high incidence. And that's also including the PEPFAR investments. So knowing that we never have enough money to scale up to 100% coverage in all of these high burden and high incidence districts in every affected countries is actually drives us to think about what we can do around making sure that what we have, we use more effectively and more efficiently. So that comes to the optimization of the implementation. And that's where we are today. And this is one of the burning questions on the ground that we hear around how best to implement, scale up evidence-based interventions. And we hope this platform will help to fill this gap. So I'll say a few words around optimization of implementation. The Global Fund is working with technical partners to ensure quality design, program of grants, so that they adequately leverage existing resources and achieve maximum impact. Most recently, with the results of the ECHO study, both Global Fund, PEPFARs, and other technical partners are talking about how we support national programs to fully integrate family planning and SRH services into HIV care for all women in the high burden incidence areas and vice versa. The Global Fund is also partnered to continue work that approaches the complex, multifaceted, innovative, and adolescent-driven response that Chewe talked about. We employ a human-centered design approach to effectively engage young populations as key stakeholders and partners in the design. The Global Fund also invests in strengthening weak health and community response systems, which continue to impede the ability to deliver effective HIV preventive care and treatment programs. And so with this, I'll end and just say the Global Fund really welcomes and appreciates this new learning collaborative, which seeks to target program implementers working in African region, including but not limited to principal recipients, sub-recipients under the Global Fund, AGYW Strategic Investments, and government ministries who would like to learn more about AGYW program models. So thank you very much.
Fantastic, Dalila. Thanks so much for that great overview of the comprehensive nature of the Global Fund's investments. We have had a few participants join us since we started and kicked off the call. It's over 80 participants on the webinar so far. We just want to make sure that we do a quick sound check to make sure that you all can hear us if you are not a panelist. Please do feel free to indicate in the chat box or speak into your mic if you can hear me. Yes, perfect. Yes, so we are good with the sound, and continue to let us know if we're having issues with the sound quality, if you're having issues hearing us, and we will try to intervene technically on our end. So with that great overview from Dalila, I think it's time to hear from our panelists. As the panelists speak, we would appreciate any questions that you have in the chat box again. And once the panelists are done with the introductions and then with the roundtable discussion, we will then open up a moderated conversation, which Pam will take us through. Our first panelist is Winnie Obure. Winnie is a feminist, activist, and human rights defender from Kenya. She served as a community liaison for PEPFAR's Dreams Innovation Project, and she leads the What Girls Want project in Kenya. She's also the founder of Teen Seed Africa and the Community Emergency Fund for Gender-Based Violence Survivors. Winnie will give us a brief overview of her work. Welcome, Winnie, and we look forward to having you on this panel.
Just tell her to unmute herself.
Please tell her to unmute.
Please do unmute yourself, Winnie.
Thank you very much, Lola. Thanks, everyone. It's great to be here. Hello. So I'm going to give a brief overview of the What Girls Want project that we have implemented in Kenya. So this one-year project that just ended 2 months ago was engaging adolescent girls and young women to be able to design programs, to be able to look at HIV intervention, to be able to incorporate sexual reproductive health and gender-based violence into programming. This project was implemented in 2 counties, Nairobi and Homa Bay, where we reached out to adolescent girls and young women in all these spaces, especially in the urban slums, in informal settlements, if you like, as well as the rural areas. So within our program, we tried to reach out using different ways, and one of them was to be able to organize community dialogues. And so we worked very closely with champions, with sexual reproductive health, HIV prevention champions, as well as peer mentors who are bringing together, different skills, expertise, and experiences. And so we got to also organize for smaller sessions, which we call the core teams, where champions are matched with peer mentors, and they get to work together with at least a team of 16 young girls during this mentorship session. And so we meet like weekly and get to share, have safe spaces, be able to get support and help, do referrals, get counseling, learn, and continuously share with their peers. So this is the kind of work that we did, and I am happy to also say that, so during this we engaged the parents, duty bearers, we engaged other community-based organizations and civil society in the different topics and different issues that we're addressing, including adherence to HIV treatment, access to safe abortion, being able to get services, post-rep care, and just being able to get continuous information and promote services in the community. Thank you.
Winnie. Next, we have Millicent Sitaile. Millicent is a youth activist and youth SRHR officer at the SRHR Africa Trust, SAT. She's an ambassador for Her Voice, a program by the Global Fund to increase participation of adolescent girls and young women and to meaningfully engage them in decision-making platforms. Millicent will give us an overview of her work and introduce herself. A pleasure to have you, Millicent. Over to you.
Hello, I hope all you can hear me.
Loud and clear.
Awesome, thank you. Hello everybody, my name is Millicent Sitaile. I am based in Botswana, in the Southern African region. And like it has been said, I work for SRH and Africa Trust, but I also wear many hats as a young person, as an activist as well. I'm a Her Voice ambassador, but I also work with a youth-led network called ATHENA, operating in the East and Southern region. My work in Botswana and in the region at scope, I mainly focus on 5 main things, being increasing access to SRHR services to young people, keeping girls in safe schools, meaningful youth participation in decision-making platforms, capacity building amongst youth-led organizations. We do a lot of capacity. We try and do a lot of capacity building for both young people who want to join the space, but also young people who are working within communities. And lastly, preventing early and unintended pregnancies amongst teenagers or adolescent girls within communities. I'm full-time with SRHR Africa Trust, and we focus mainly, as it's a donor organization, we focus mainly on providing finances to organizations that fully focus on increasing access to SRHR services to adolescent girls and young women, including boys as well. We currently have a campaign called Teen Wise, where we link young people with service providers by creating mobilization, fun, interactive mobilization, and going to where young people are and actually providing these services, these SRHR services. We work with schools, both senior and tertiary education. And we normally only work within communities. We have a mobile clinic that goes around and provides services to young adolescent girls and young women. And the reason why we came up with this, it is because of the issues that we had identified, which are issues of lack of access. Young people don't have access to services, either because of issues that are seen, being all ranging from attitudes of service providers to not having costs to go and access these services, or societal attitudes that are relating to actually young people accessing these services, these SRHR services. The list goes on. So we come in and try and curb that difference, or we try and bridge in that problem that we have identified. And so far it's been really doing well. It's also on social media, where we use a lot of social media, where we know a lot of young people, or specifically in Botswana, young people do use social media. Young people do use Facebook a lot. Young people use Twitter a lot as well. So we try and actually be on their face, where we know we can always and easily to find them. And then with keeping girls in safe schools, we've created clubs. We have what we call Youth Hub, where we're creating clubs within different schools to build capacity of adolescent girls and young women, including boys, where we equip them with different skills, from your health, how to take care of yourself, how to stand up for yourself, etc., entrepreneurship skills, and other skills, just to help them and enhance them to actually become better leaders. It's more on leadership building. That is one small project that we do within schools. Others, I believe I will have an opportunity to talk about them, because it's quite a lot, but because I don't have a lot of time, that in summary is the work that I currently do within the country, and some of them overlap to actually being part of in the region. Thank you.
Thanks so much, Millicent. We have the pleasure of having, last but not least, Brenda Foreman, who is a youth activist and the CEO of Obure Hub Limited, a newly founded company geared towards addressing the issue of plastic bottle waste and empowering marginalized girls economically. Brenda is also a Global Fund Her Voice ambassador for Cameroon, where she advocates towards including adolescent girls who have been excluded from the national policy dialogue around HIV in Cameroon. Brenda will also give us a brief overview of her work, and we're glad to have you, Brenda. Over to you.
Thank you. Thank you so much. Hello, everyone. It's actually a very unique privilege to be here, and a big thank you to UNICEF and the Global Fund for this learning collaborative. As said, I'm Brenda Foreman, and I'm a Global Fund Her Voice ambassador, founder of a girls initiative titled the Violence Against Girls Initiative, and also the CEO of a newly founded company, AGYW Hub Limited, which in full means the Girls Empowerment and Recycling Essence Hub Limited. And I'm an ambassador to key leading organizations in Africa. And the work I basically do through this several institutions, firstly, with the other organizations, key leading organizations, is basically tilted on youth empowerment, where youth are enlightened on leadership development, career aspirations, capacity building, academic prowess, and health issues. And this has given me the opportunity to have a direct impact on the lives of over 40,000 plus youth across several African countries. And coming to the Violence Against the Girls Initiative, it has really been a very great opportunity to address issues of sexual and gender-based violence in my country, most especially in Islamic-dominated terrains and very rural communities where girls are not actually reached out to, on a daily basis. And this has given me the opportunity through my movement, alongside with my team, to be able to reach rural communities where traditions and cultures actually encourage sexual and gender-based violence through focus group discussions and medical outreaches, reaching over 66,000 girls with medical campaigns like free medical screening and several other aspects. Liaising as well with also government authorities and administrative authorities like the Ministry of Education to run sex education campaigns, in schools as well, engaging thousands of girls and young boys on issues concerning their sexuality and their health. It's been a lot of work, a lot of progress we've been able to make, as well as influencing these policies and breaking through these traditions, going as far as actually dressing like, Muslim girls to be able to storm their terrains and reach them at their doorsteps, having the go-ahead of the lamitos of most of these, rural communities. And also overcoming the death threats that works like this actually involve. Also working with Her Voice Fund, being a Global Fund Her Voice ambassador. It's been one of the major highlights of my life as well, because the work we basically do is influencing, policymakers on the national HIV and AIDS policy that excludes adolescent girls and young women. So it's been a lot of work working with organization heads, this is where collaboration and partnerships come in, because I've been able to liaise with heads of several organizations that do a lot of work in regards to adolescent girls and young women in the aspect of HIV/AIDS and several other infectious diseases. And as well, getting them on board and getting these organizations heads to be able to form a synergy where we could reach out to the Ministry of Health directly, from the level of the minister right down to district medical officers and health experts. And there's been a lot of progress we've been able to make, and also we've been able to bring girls together, adolescent girls and young women, to be able to make a lot of statements in regards to issues that concern their health, especially when it comes to sexual reproductive health. And the progress we've been able to make takes me to, the milestones that I've been able to attain as a result. Being invited by the Global Fund to speak at several global events on the importance of investing in the sexual reproductive health rights of young girls and women. And that takes me to speaking at the global financing event in Canada during the Women's Deliver program, speaking at the pre-universal health coverage event in New York for the 72nd session of the United Nations General Assembly. And of course, the SEED Global Fund Replenishment event that just took place in Lyon. I had the privilege to speak at the private sector event. And lastly, talking about GYW Limited, the inspiration came as a result of a session I had with students of Pearson College in Canada back when I traveled for the Women's Deliver program. And we had just this round table talk where we got to talk about the gender gaps in several countries all around the world. And there was something, one of the teenage girls, a very strong and remarkable statement she made, and she's from Bahamas, I remember so well. She said, a girl's voice will only be heard if she's economically empowered. And this was the reason why I decided to set up GYW Limited. After the business pitch was qualified for a grant by UNICEF, a German firm. So basically what we are doing is solving one of the most pressing global environmental issues, that's plastic bottle littering, and giving girls the opportunity to work with us and get paid, and also to be able to get funds to sustain themselves and their families. So that is just a brief of what I do and who I am and the progress I've been able to make so far. Thank you so much.
Oh, quite fantastic, Brenda. What is striking listening to each of you speak up about your initiatives is the diversity of your experiences, the passion and the energy you bring, and the creativity in linking different development challenges, all of which play a role in the lives of girls and young women on a daily basis. Next, we're going to go into a moderated roundtable discussion. There are lots of questions coming in through the chat feature, and we want to thank everyone for sharing their submissions, which will be handled at the end of this question panel. The first question that we'd like to have each of you reflect on are the challenges and the barriers that you faced in developing these initiatives. We've had the privilege of hearing your initiative, the summary of your initiatives, now that they're a bit more robust and they've been implemented for a while. But I think it would be of value to have those of us online here, how you've been able to engage parents, how you've been able to engage communities, to identify peer mentors, and then overcome some of the challenges and the roadblocks that you encountered. I'm going to start with Millicent, and then anyone else who would like to chime in on this question is more than welcome to. Over to you, Millicent.
Am I answering the questions? Should I answer the questions that have been directed specifically to me?
Yes, please. And very specifically, the question on challenges and barriers.
Yes. Okay. Let me just straight to the challenges and barriers. I've been asked on one, which is one of the major challenges that we have, which is differentiating between service provision for urban youth and rural youth. One thing that we realized now that we work with both urban and rural youth is that we can't provide the same service for all of them. The needs are different. So how we structure our service delivery method is different. In rural youth, for us to mobilize, we actually mobilize within communities. This is through posters. This is through word to word. This is through the community groups that are there. But with urban youth, you find that it's very easy because social media is great and it provides easier ways of, in terms of Facebook, we were able to create a post and boost, and then the young people who are within that urban area can see it and can actually easily request, or yes, they can request and book for services. And then whenever we're in that area, they come and access those services. But so that's how we were able to work with both urban and rural youth, because first it was very difficult to actually reach rural youth because of issues of access to technology, access to internet, access to phones themselves, up until we realized those barriers, because that they then come as barriers. That is when it was easy for us to provide services to them based on what is their needs. Also, the services that they want are totally different. You find that urban youth want short-term services as compared to rural youth who want long-term services, because they rarely get a chance to actually access these services. So it's a once-off thing for them, or at least that's what we've seen so far with the work that we've been doing. I think that's the first question on barriers. And then the other problem that we have is connecting, another barrier is connecting the sexual reproductive health needs and demands with actually providing the supply. The government is facing that challenge. A lot of civil society organizations are facing that challenge, where it's difficult for organizations to identify what sexual reproductive health needs and demands young people want, or amongst young people, adolescent girls and young women, and providing the supply in terms of what they actually what the young people actually need. We found that there's a lot of work done. The Lancet report recently did provide on basic ways we can actually provide SRHR services to young people, which I will share later on, specifically the Lancet report on SRHR and how best we can move forward providing services to young people, which includes in schools, in communities, using social media, and in different facilities, together with the types of services that can actually be provided. I will share with those with Pam as time goes on, and then we can read on to that.
Perfect. Thanks so much, Millicent. Brenda, Winnie, any thoughts from you on the barriers and the challenges as you've been mounting these initiatives? Anything that Millicent hasn't mentioned so far?
Okay, so thank you. I'm just going to add a little bit on what Millicent has shared, that working with adolescent girls and young women in informal settlements as well as rural areas is that the initiatives are not well-funded, not even well-funded, but when it's a women-led or young women-led initiative, it doesn't have enough support, or it's not resourced enough. So it makes the work very difficult because of the under-resourcing. The second thing I would also want to say is that the young women and girls who are willing to engage on decision-making spaces sometimes don't even have, like money to buy data to be able to be connected virtually, because some of these processes and policy work happens regionally and internationally. So you realize that if a young woman is willing to participate where they are and they want to be part of that process, they are unable to do that because of high data costs, as well as sometimes when the meetings high-level meetings are happening regionally or internationally. Some of the young women and girls do not get visas, which is a big hindrance because you really want to participate, but you're looked at in terms of, you know, you cannot get a visa to be able to travel to some of these countries where these meetings are happening. The other one that I could say is that, so young women, another challenge is that young women find it really difficult to attend meetings because of the places where they're happening. For instance, you need transport, you need a meal, you need agendas in advance, you need the documents to review and just be able to make your position clear. And lastly, the other challenge that I have faced working on this project is that, so you find that the need young women have is quite a lot, from even accessing menstruation products like the pads or panties. And so you're turning between you know, being in a space where you have to hold your leaders accountable and your realities, being able to find your needs at that particular time. So it makes it really difficult when you look at, you know, HIV prevention, and it's complex because it's not just HIV prevention. You find girls who still going hungry in this end of the year. And you also find that when a girl has been raped, for example, or defiled, there's so many things that comes into place, including getting, being able to get a safe house for them to just find some time to collect themselves, to access counseling, to be able to, you know, have a place that is safe for them to get the services. So some of the ways we've been able to do this is that, for instance, ATHENA is very networked, and through our networks, through our partners, we've been able to do referrals. We have, in fact, gotten other ways of partnering with others to be able to give out support. For instance, when you have a community dialogue and all we're giving is capacity building, or we are just supporting them to understand some of these issues, then we get a community partner who is willing to come and give the sanitary pads, or someone else who is you know, willing to come and give out like HIV testing or to do screening, cancer screening and stuff. So partnering and being able to connect with the other community-based organizations and NGOs working around has been super helpful. Thank you.
Thank you, fantastic. I think maybe we should move on to the next question, and we'd love to hear from each of you. We'll start maybe with Brenda first. On your role, reflecting on your role representing young women's voices at the national and the regional level, what specific insights, lessons learned do you have about how to work with policymakers to ensure that girls' voices are actually accounted for in policy development and in national program design? Over to you, Brenda.
Well, thank you so much. Actually, I just want to use a very pragmatic example. Back in 2017, when I had the opportunity to have a one-on-one dialogue with the former Prime Minister of my country, it showed the level of ignorance most of the leaders, you know, have. Because I had the opportunity to table a lot of issues that youth as well as teenage girls face. For example, the aspect of girls not being able to stay in school during their menstrual cycle because they don't have access to sanitary pads. Most of them could be from very marginalized backgrounds where they can't afford that. And this was actually very intriguing on the side of, you know, like my Prime Minister at that time. Like, it was something that he couldn't believe. And so taking me to the aspect of working with most of these policymakers or leaders that have a lot to do with making policies that affect girls directly or indirectly, I would say that with me, I've been able to bring the situation to them. Because most of the time, the challenges that a lot of program organizers or policymakers face is assuming solutions to problems without necessarily knowing what the core problem is that adolescent girls and young women face. So you actually sit in your home and you just pick think about something, think about a solution, and you're like, okay, maybe this is what is going to best fit these people, but you've not been able to do a survey of the particular area to know what the primary problem is. So I've been able to take to them primary challenges, you know, that girls and young women face, making them to be, giving them the opportunity to actually fit into the shoes of these girls and young women. Because you actually will not be able to convince a policymaker without making him see the reality. So you have to fit into those shoes. So to me, on my take, it's been, you know, helping them fit into those shoes, bringing out the realities by talking about core challenges that I face in implementing most of these projects. For example, the aspect of me endorsing a project in the northern part of my country. Core challenges were challenges of traditions. You know, breaking through these traditions were really very, very challenging, but I was able to break through. The aspect of inaccessibility of some areas. How do you actually explain that there are areas where you cannot be able to reach girls by car? You have to walk by foot, 13 kilometers by foot, or actually take a bike, you know, to reach through forested areas to reach most of these people. And you find a population of over 5,000 girls and young women there. And most of these people depend on another rural area where it's actually like 13 to 14 kilometers apart. In times of emergency, these people cannot access healthcare. So bringing out all of these gaps, making them see the reality of most of these problems, and making them realize how important it is for them to step in and how they have to step in. So making them realize that policy, it all boils down to policy making, because without the right policies, with biased policies as well, issues like this can never be addressed or rectified. At the same time, emphasizing on the importance of investing in aspects like this, because most often, a lot of times we take for granted the importance of investing. Like Winnie just spoke about the aspect of resources and funding and everything. Without the right funds or materials or everything that is required to you know, reach out to adolescent girls and young women, it would be very, very impossible to be of help or tackle most of these diseases like HIV, AIDS, malaria, TB, and several other infectious diseases. So as a young woman and a voice at the national and regional level, it's been my work to be able to take to the notion of policymakers the challenges that young girls and women face, as well as the heads of grassroots organizations as well, because I work closely with them, knowing their challenges, doing a one-on-one call with them, meeting them one-on-one, knowing what their challenges are. So it's like being a spokesperson, a middleman at the same time, and also helping policymakers fit into the shoes of these people. So basically, that's the work I've been doing. Yeah.
Fantastic. Thanks for your submission, Brenda. Over to you, Millicent, to respond to the same question and to give us a few practical nuts and bolts on how we identify, we equip, and we link the next generation of young womanist and feminist leaders to the national processes. Thanks so much, Millicent.
Thank you. I think the most important thing is how we reform policies that are already there that we know don't favor adolescent girls and young women, specifically to
She's gone. Millicent, do we still have you? If not, while we resolve these technical issues, maybe over to you, Winnie, to give us a few of your thoughts, and then we'll come back to Millicent when she joins.
Oh yeah, sure. So I think for me, just being able to support adolescent girls and young women regionally and globally to participate in policy making is not just about, you know, like reviewing some of these policies, but it's to be able to prepare the young people, the young women and girls to be part of this process. Because most of the time we just look at young women as, you know, as just and sort of an affirmative action thing, just bringing them on the table, because you look around and say, oh, so we have 4 men and we have 4 old men, let me say, and we have women, but we don't have young women, we don't have adolescent girls in this meeting. It shouldn't be looked at in that way. So I think for me, to all policymakers, is that it is very, very important to engage adolescent girls and young women from the onset, to be able to work with them, to be able to, you know, support them from the design to the research to implementing, reviewing, monitoring, and ensuring that their voice is heard. Not just having them on the table for purposes of, oh, so we have young women represented, but those that are representing, who are they representing? And what specific constituency? Because again, we are not homogeneous as young women, as adolescent girls and young women. So it's very, very important to look at it from an intersectional point of view. And that also, even among the young women we have, for instance, young mothers, their needs are absolutely different from young girls. You know, like a young woman who's 18, their needs are totally different from a young woman who is HIV positive and is married or has gone through some other cultural harmful practices. So one of the things is to be able to just bring all these categories of young women and adolescents on the table. The other one is to consult at all levels. We cannot just make assumptions or consult when we are on the last stages, but it is key to be able to consult at every level and give feedback. Like say, so this is the far that we've gone, and this is what needs to be done. What do you say? What do you think? I also think additionally that when policies are made and processes, especially those at regional and international levels have been made, it is important to have them back to the community so that these young women can continue to engage. That we are having this at an international level, but how does that come back down on the ground for them to even understand better and get to engage both during, before, during, and after some of those high-level decision-making spaces. And when I'm talking about inclusion of young women and girls, it's not just inclusion for going to conferences, to meetings and stuff, but being able to meaningfully participate, yeah? To be able to intentionally prepare them with the, the language. How do they engage? How do they, do the framing of some of these issues? Because from my experience, all the young women and girls I have worked with understand, they know their needs, their priorities, and they know what they want and what works for them. But sometimes putting it in a language that is understandable might be a challenge. So for me, is to be able to work very closely with this category of young people to strengthen some of those policies that we're talking about, but to also be part of implementing them, and most importantly, holding the leaders accountable. That young people must be part of holding these leaders accountable, because it's our life, it is our world. And when all has been said and done, we lose the most. So this is really, really critical, that we get to listen to the voice and we get to understand each other from that point of view, and to just know that this struggle is real. The girls who stay in informal settlements in the slums are even double, thrice disadvantaged, as well as the girls who are staying in rural areas where they cannot access internet or smartphones, while we are talking about leaving one behind. So for me, finally, is just to say that we are not making these policies for us. We are not doing this kind of work for us now, but for so many other billions of young people who are coming behind us. Thank you.
Thank you. And on that impassioned note, I think this brings us to the end of the moderated session of this webinar. We've heard from our panelists, our illustrious panelists, the reality that girls' experiences are diverse, that the types of preparation and investments we make to bring young women to the fore needs to be reconsidered and need to be really nuanced towards the young women's realities in order to hold governments and our leaders accountable at the national level and beyond. I think with no further ado, I'll turn over to Pam, who will lead us through a session digging through some of the questions that we've received over the last hour, and there are dozens of them in the chat box. I think this conversation could go on for hours. In the interest of time, we will cap this off in about 5 to 10 minutes and then look forward to having a virtual dialogue following this. Over to you, Pam.
Thank you so much, Lola. And as Lola had mentioned, we have received over 20 questions to the panelists during the last 45 minutes or so. Some of them we can get through right now, and the rest we will definitely try to answer all of them in the Yammer group for those who have joined us in the Learning Collaborative. So in terms of the themes of the questions, one that came up a few times is about multi-sectorial coordination. Like, how do you envision working, given the complex needs and reality of the lived experience of women and girls? How do you partner with different sectors? So that's the first question. So would you like to take that forward?
Do you want to direct it out?
Millicent, if you're still there, would you like to answer that question on multi-sectoral partnerships?
Hi, I'm sorry I got cut off again. I think the most important thing is partnership with government institutions, because they have more funds. They can carry. They are more at advantage to carry sustainable programs that will take long terms. But it's very difficult to. It has been very difficult to actually bring in civil society organizations and government to work together in order to develop, or in order to actually carry out programs that meaningfully impact communities, adolescent girls and young women. So I still believe and think that the best approach that we can do is really finding ways in which we can work best with our government, with our UN families, and bringing all civil society organizations together, because you find that we're fighting for the same, we're all trying to do the same programs, yet trying to target the same person, which is a young person. Our collaborative efforts, if we come together as organizations, it's easy for us to actually target and actually provide comprehensive solutions to the problems that the young people face.
Thank you, Millicent. Brenda and Winnie, do you have anything to add on that question about multi-sectoral partnerships? Winnie, would you like to say something?
Yes. So what I would like to say that has worked for us for the What Girls Want project in Kenya is just being able to involve everyone, because at the end of the day, a girl goes back to a house. So engaging the parents and letting them understand some of these issues is very critical, because parents are part of the people who sometimes are not very supportive because of the other cultural aspects, and also just to be able to support these young people, because at the end of the day, we do all this programming, but the young people go back to houses, they go back somewhere. So important for us that even as we engage partners, parents are the #1 partners who sometimes are left behind. In our experience working with the parents, some of them who started off opposing the project and saying, how do you want to just teach my girl about contraceptives? She's still young. Why do you want to give out sexuality education? Why do you want to, keep meeting every Saturday? My daughter is supposed to be helping me clean the house and do whatever. After they understand exactly why the children need to be engaged in this kind of program, then they're the first one to even, you know, support and give them the moral support that is needed for them to continue. Even as we look into the other partners, we know like the religious institutions, we have the governments who must do their work, because our work is not to come and do what the government is supposed to be doing, but to complement what that looks like. And also just bring in the different partners, because a girl needs a lot. Like during the period that we've been implementing the project, to realize that the girl will come for some of these sessions, for the sessions during the weekend. Maybe they've been abused, so they have to go to a health facility. So there you bring a health facility, a health partner, and then they have to go to school. And when they're going to school, they need school fees, they need menstruation products, they need, you know, a lot of things, school fees and stuff. So for me, it is really important that we look at it from that kind of an angle where everybody comes in to contribute to something. That way we can be able to all hold a part of all this work, and more importantly, to continue pushing our government, and to also continue pushing even the donor community to respond to the need on the ground, not what they want to achieve, you know, at the end of the day. Because there are normally two things when you're working with adolescent girls and young women. Some people want to achieve certain objectives that are not in line with what the need is in the community. So I think when the donors, implementers, the community get to understand where we're going, so it becomes easier to even put money where it's supposed to be. So for young women and girls that we have engaged with, and I'll give an example very, very briefly last week, is that they kept saying, we want to be able to participate in decision-making forums. We want to be able to be facilitated to speak on our behalf, and not always have someone else to come and speak on their behalf. You know, through their lived experiences, they know quite a lot, and that goes into shaping what the programs will look like, and even including during monitoring and evaluation. Thank you.
Wonderful. Thank you so much. Would you like to wrap up and summarize? So we've come to the top of the hour, and wanted to thank you all for your participation, for the spirited dialogue in the chat boxes, and for the insights and the wisdom that you've been able to share in the hour so far. We'd like to invite you all to join us on Zoom, to hang out with us on Zoom. On Yammer. We will share the Yammer link once again for those who already are on Yammer and who are participating in the dialogues. It will be an opportunity to continue to interface with our panelists and to have some of the questions that have been asked responded to. I think what we will do is pull together a digest of all of the questions that were asked. We'll synthesize those, and we'll have our panelists respond to these. So these will go out along with the recorded link for the webinar. I think we'd like to say good afternoon, good evening to you wherever you are, and hope that you have a wonderful rest of your days. Thank you all, and look forward to being with you on the next webinar, which will be announced shortly. Thank you. Thank you, everyone, and thank you for joining us. Thank you, the panelists.
Thank you very much for having us.
Yes.
Thank you. Thank you so much for having us. Thank you.
Thank you.